Welcome, everyone. I'm Andrea Shore with the School-Based Health Alliance. We're really excited to see so many people joining today, and I see more and more continue to come in. So we're really excited to have you all here. We're going to go ahead and start out with some slides and welcome you, and I'll introduce our presenters today and give you a little bit of the logistics. If we could go ahead and launch a slide, that'd be great. Thank you. Great. Welcome to today's session. Today's webinar is called COVID-19 and Unaccompanied Homeless Youth, School-Based Strategies for Support. So we are hosting this today, the School-Based Health Alliance, and we work to improve the health of children and youth by advancing and advocating for school-based health care. We believe that all children and adolescents deserve to thrive, but too many struggle because they lack access to healthcare services. School-based healthcare is the solution, bringing care to where students already spend a majority of their time, in school, and that can be via in-person care or telehealth care. When health and education come together, great things happen. Attendance improves and conditions like asthma and diabetes are better managed. Behavioral health issues get quick attention, and we know healthy students make better learners. Next slide, please. Thank you. We believe that all children and adolescents deserve to thrive, but too many struggle because they lack the access to care. We believe in this transformational power of the health and education intersection. So now we're going to go ahead to a few housekeeping reminders. So today, as you can see, we're using the Zoom platform. All attendees are in listen-only mode. So to ask any questions during the session, we invite you to please use the Q&A icon that appears at the bottom of your Zoom panel. You can also drop questions or comments in the chat box. And you see here when using the chat box, please select all panelists and attendees before typing a message so that everyone who is here today can see your message. If you want to turn on the closed captioning, please click on the CC button. And then we're going to ask you to please complete a very brief evaluation poll that will pop up on your screen at the end of today's presentation. This session is being recorded and will be available on our website before Friday, December 17th at the end of this week. So it's my pleasure to share today's objectives. Today, the presenters will help the audience understand the unique experience of unaccompanied youth who experience homelessness and the barriers they face during the pandemic. Understand the federal education rights afforded to unaccompanied homeless youth, as well as state laws related to minors' ability to consent to COVID-19 resources, and to be equipped to find resources to implement federal and state laws related to unaccompanied homeless youth, education, and healthcare. So it's my pleasure to introduce our three presenters today. The first presenter you see on the screen here is Patricia Julianell. She's an attorney and legal consultant for state and local governments and nonprofit organizations. She's an expert on education law and policy, including the rights of children and unaccompanied youth experiencing homelessness, students with disabilities, and undocumented immigrants. Patricia graduated from Yale University and received her JD summa cum laude from Lewis and Clark Law School. We'll also hear today from Barbara Duffield. She's the executive director of our co-sponsoring webinar today, Schoolhouse Connection. Schoolhouse Connection is a national organization working to overcome homelessness through education. For more than 20 years, Barbara has bridged policy and practice in early care, education, housing, and homelessness. Barbara received her bachelor's degree summa cum laude in political science from the University of Michigan. And then we have here today with us Levi Bowen. Levi is currently a special assistant in the Office of Elementary and Secondary Education at the U.S. Department of Education. Levi previously served in the Obama administration of the U.S. Department of Education, where he worked in the Office of Legislation and Congressional Affairs and the Office of the Secretary. Most recently, he served as a policy entrepreneur at Next 100, a public policy think tank, where he focused on early childhood education policy and P through 12 education policy. He holds degrees from Teachers College, Columbia University, and Texas A&M University. So without further ado, we'll go ahead and pass the presentation on to our experts today.
Thank you very much, Andrea. We are so grateful for the School-Based Health Alliance for co-hosting this webinar and for just being such a gracious partner as we attempt to tackle these really complex and critical issues for our young people. You've already given the bio for Schoolhouse Connections, so I don't need to spend time on this slide, but there's lots of resources on our website. Next slide, please. A little bit about today's agenda. We want to do some level setting. We know that we will have some in our audience for whom McKinney-Vento is what they live and breathe, but there may be others for whom the topic of homelessness and unaccompanied youth is new. Some of our school-based health providers, there may be some basic information. So we'll do a little bit of context setting and then dive right into the strategies and some of the legal issues around promoting access to vaccines, COVID-19 testing, and a safe return to in-person learning for our youth who are experiencing homelessness. Next slide. So first, again, just some level setting about when we say homelessness or when we say homeless in the context of education, we're talking about a broader definition than what many people may typically think. So it's a very hidden population, and most students who are identified as experiencing homelessness are not in a shelter, they're not outside necessarily, they're staying with other people temporarily due to loss of housing, economic hardship, or a similar reason. So on the right-hand side of the slide here, you've got the different categories that are considered homeless under the federal McKinney-Vento Act, which covers K-12 school systems. And you can see not only the different pieces of the definition, but also the percentage of students when they were first identified as homeless, where they were actually staying. The one piece I'll say here is that with the pandemic, we see fewer students who are staying in shelters because there's a fear and there's fewer shelter spaces. And also just generally our youth who are homeless and unaccompanied are more likely to be staying with other people. Next slide, please. In terms of the scale, the prevalence of student homelessness, this is a graph that shows a long-term continuum in terms of the number of students identified pre-K through 12 experiencing homelessness. And what I want to point out with this particular slide is this is for the 1920 school year. So it encompasses the early part of the pandemic, and you can see a decline there. That's not because homelessness decreased in the pandemic. We did a survey of liaisons last fall, and what we hear back is really the challenge of identifying students who are experiencing homelessness when in-person learning, the eyes and the ears of the school system just weren't there. So there's been a nationally decline. What we're hearing anecdotally from schools now in many places of the country is with the return to in-person learning, identification can happen, and they're seeing those numbers go back up again. Next slide, please. Also a point here, when we asked, the data I showed in the previous slide was from schools, when we asked young people themselves to indicate whether they'd experienced homelessness, had been in any of those situations, we see a much higher rate of homelessness. So this slide is the Youth Risk Behavior Survey, and you can see about 5.4% of high school students indicated that they'd experienced homelessness in 18-19. That's twice the level that schools identify. So we have a gap in identification that was a challenge before the pandemic. It's an even bigger challenge now. Next slide, please. We are focusing in this webinar specifically on youth who both meet that definition of homeless and who are unaccompanied, meaning under the law, they are not in the physical custody of a parent or guardian. And there are lots of different reasons why a youth may experience homelessness on their own. On the right-hand side of the slide, you have some of the reasons that research has documented, and certainly that we see with our young people in our scholarship programming, what we hear from liaisons. So often it's a youth who's leaving home because of abuse or neglect. Home is not a safe place for them. They've been kicked out for a number of different reasons: parental substance abuse, kicked out because of sexual orientation and gender identity, pregnancy. And we also know that loss of a parent or caregiver is a contributing factor to youth experiencing homelessness. Chapin Hall at the University of Chicago found that 35% of youth who were experiencing homelessness on their own had a death of a parent or caregiver. So you think about what's happening right now with the pandemic and the loss of parents or guardians, and we know that that will be contributing to youth homelessness. Next slide, please. Looking at the numbers now, specifically for youth who are homeless on their own, again, this is research from Chapin Hall at the University of Chicago. And again, it's a broader, a higher number than what schools typically identify. So if we're looking at youth between the ages of 13 and 17, about 1 out of every 30 youth was found to be a minor experiencing homelessness. And again, that's much greater than the number identified from public schools. About 9% of all of our pre-K-12 homeless students were in an unaccompanied situation when they were first identified. Next slide, please. I am now going to turn it over to Patricia to talk a little bit more about who is more likely to experience homelessness.
Yes, we know from the Youth Risk Behavior Survey that I'm sure most of you are familiar with. It's administered in high schools and some middle schools around the country. In a number of states, they ask questions about homelessness. And so we've been able to analyze the data and find what we knew from other sources of research as well, which is that students of color are overrepresented among youth experiencing homelessness. So Black high school students are 2.25 times more likely to experience homelessness than white students. Hispanic students about 2 times, and Native American students just a little bit under twice as likely. Also, when we look at our LGBTQ population, if we just look at lesbian, gay, bisexual, or questioning students, they're a little bit more than twice as likely to experience homelessness than heterosexual students. But when we pull out and look only at students who identify as transgender, they're over 9 times more likely to experience homelessness than cisgender or non-transgender students are. So again, it's some pretty shocking disproportionalities here for our transgender students. And then the biggest number on this slide is 10 for students who have been pregnant or parenting or have gotten someone pregnant to their knowledge. They're 10 times more likely to experience homelessness than those who have not been involved with a pregnancy. So any of you who are working with programs who are serving pregnant or parenting teens, there's certainly going to be a disproportionate number of those students, unfortunately, who are experiencing homelessness. The Youth Risk Behavior Survey also has a lot to tell us about some of the health risk factors that are experienced by our students who are going through a homeless situation. So I won't go over all of the details on this slide here, but in terms of mental health, behavioral health, substance abuse, we know that our students experiencing homelessness are much more likely to actually attempt suicide, to be using a variety of substances, everything from alcohol and tobacco to methamphetamines and harder drugs. And then looking at some of their sexual risk behavior, they're more likely to be victims of dating violence. And so there's just a lot of serious health risks that are being experienced by our students who are going through homelessness.
I'll pick up here, and just this slide here comes from the U.S. Department of Education data to show that the impact of homelessness on graduation. And the key takeaway from this particular slide is to see the impact of homelessness above and beyond poverty. So we see a big difference in who graduates high school when we look at this particular data, really showing homelessness as much more than just not having a place to stay, and tremendous impacts on outcomes as well. Next slide, please. Just to make the point here, we have chronic health problems caused by homelessness, trauma, mobility, enrollment barriers, which lead to high rates of chronic absenteeism. One slide earlier showed 36.7% rates of chronic absenteeism before the pandemic, more rates of punitive discipline, lower graduation rate, and the lack of a high school degree then is the single greatest risk factor for continuing to experience homelessness as a young adult. So bringing school and health together is critical to break this cycle of homelessness. Next slide, please. Impact of COVID-19, I've sort of touched on this in some of the previous slides in terms of the challenges with stress of people who are staying together. Someone sneezes and you get kicked out of where you're staying. So more mobility, obviously evictions leading to more homelessness and families breaking up that way, fewer shelter options, a lot more isolation, certainly the basic needs and mental health issues of COVID-19 have heavily impacted students experiencing homelessness, particularly unaccompanied youth. And then the school barriers as well, from enrollment to not having devices, not having a place to charge a device. And then the topic we're really going to dive into, the barriers to vaccines and testing as well. With that, I'll turn it over to Levi.
Thanks, Barbara. I appreciate it. My name is Levi Bowen. Pronouns are he, him, his. I'm very excited to be with you today. Before I jump in, I do want to thank School-Based Health Alliance and Schoolhouse Connection for the opportunity to join and speak with you today. This is something that is very important to the administration and obviously and very personal for me as an individual. As a youth, I experienced homelessness when I was in high school and in college, and I know that I had days wondering what resources were going to be available to me. There was a period of time in my life where I was not sure that I was going to be able to graduate from high school, much less be able to go and achieve higher education. But it was because of the hard work by my teachers and educators at school that were able to connect me with the resources, many of which are still available today. And that enabled me to find a place to stay, be able to graduate from high school and go off to college. So I know the role and the importance of schools for students experiencing homelessness, and this is something that's very deeply personal to me. McKinney-Vento is as it says on the slide, the piece of federal legislation that protects the rights of students experiencing homelessness. It's particularly designed to remove educational barriers for these students. It includes a litany of things, and a number of them are articulated here on the slide, including an immediate enrollment in school, the right for these students to receive immediate enrollment, the right of the students to transportation of school of origin. That means basically where the child was originally enrolled at the beginning of the school year, and provision of services comparable to services offered to students in the school. Again, particularly designed to remove barriers to education and protecting the rights of these students. On the next slide, you'll see a couple of a part of the role of the liaison. So the McKinney-Vento liaison plays a critical role in most schools, in all schools and districts, in making the actual work happen. They play a variety of roles. They play a role in identifying students experiencing homelessness through outreach and coordination of activities. They make sure that students are enrolled in classrooms. They make sure that students have access to educational services, which could include everything from Head Start to whether or not a student is eligible for an IEP or an individual education plan. They provide referrals for healthcare and dental care and mental health care and far much more. And they also provide training for students for staff, for protecting the rights of students. On the next slide, I do want to take a step back and talk briefly around some of the resources that were made available by the American Rescue Plan for students experiencing homelessness. As a lot of folks on this call probably know, the American Rescue Plan that was passed in 2021 included a historic $800 million set aside for homeless children and youth. The critical funds that were made available for students have already been put to use by states and districts and are specifically designed to support the identification, school engagement, and provision of wraparound services for students experiencing homelessness, and particularly those in underserved populations or experiencing homelessness as a result of the COVID-19 pandemic. These funds were made available this year to states to distribute to districts. On the next slide. And now that ARP-HCY has launched, as ARP-HCY is what we call it, with almost all states having awarded their ARP homeless funds from the first tranche to districts, we've already seen some great progress. Over a quarter of states have had their plans. Each state had to submit a plan as a part of ARP on how they were going to protect the rights of students experiencing homelessness. We've already approved over a quarter of those here at the department, and we greatly appreciate all of the work that's happening on behalf of states and districts in order to get those funds to districts so they can go ahead and start supporting these students in a very urgent way. And nothing is more important to us than seeing these resources extend to as many students and school districts as possible. There are a number of unique opportunities and priorities for the ARP-HCY funding. On the final slide, I go through a couple of these. I know I'm pressed for time, so I don't want to talk too much, but it's going to be critical for states and districts to continue to identify students, particularly those impacted by the COVID-19 pandemic and underserved communities. States and districts are going to have to work with community partners and maybe new partners that they haven't worked with in the past to identify these students and provide educational services and wraparound services. I think I speak again before too long, but I'm happy to turn it back over.
Thanks, Levi. I'm going to jump into some of the information that we wanted to share with you today around access to vaccines and to testing, particularly focusing on those unaccompanied homeless youth that Barbara described earlier. So again, these are youth who are experiencing homelessness. They are not with their parent or guardian, usually because of some kind of abuse, neglect, other sorts of family issues. And many of them are under 18. And so they run into some difficulties accessing all kinds of services when they don't have a parent or guardian to consent for them. So we want to talk specifically about COVID-related services. So to start with, in terms of helping these youth who are under 18 to access medical care, it's important to know that 34 states and the District of Columbia actually do have laws on the books that provide rights for minors who are living on their own to consent for their own healthcare in a number of different circumstances. So there are a couple of different categories here. Most states, more than 34, I don't know the number, but close to all of them do have some laws on the books around access to mental health care, pregnancy-related care or prenatal care, sexual health care, and also substance abuse care. What we're talking about here, though, is just general routine medical care. You've got an eye infection, you've got a stomach flu, you need to go to the dentist, and vaccines, unless they're specifically exempted, would be included under that as just sort of your basic kind of routine healthcare. So in those 34 states, and on this PowerPoint, this is a live link, as you can kind of tell from the different color there. You can go to a summary on our website that has all of these 34 state laws and the DC law listed right there. So you can immediately check and see, is my state on the list? What does my state law say? It's a little bit different from state to state, but generally speaking, what these laws say is that when a youth is under 18 and they're living on their own for whatever reason, they can go ahead and consent for these different kinds of just basic routine healthcare on their own. So again, for your unaccompanied youth who are trying to get a vaccine, they should be able to access that on their own in those 34 states and DC, even without having a parent consent for them. So in our experience, we found that a lot of people don't know about these laws, or they know about them, but they sort of almost kind of don't believe it. Like, wait, can I really do that? Can I really give a 16-year-old a vaccine just because they consented on their own? And we're here to tell you that, you know, if you're in one of those jurisdictions that has those laws, yes, you can. The laws are pretty clear, and most of them have been on the books for many years. There's a new one in North Dakota from 2021, and DC's is new from 2021. But other than that, these are laws that have been around for a while. And then some local jurisdictions also have their own ordinances. So if you're not in those 34 states or DC, it might be worth checking with your county, checking with your city, because there might be an emergency ordinance that has been passed just because of COVID-19 that also extends those rights to youth. So it's almost in a way kind of safer to assume that youth can consent than to assume that they can't, just based on the number of states and jurisdictions that have these laws. On the next slide, a little bit around some of the strategies that can help promote access to vaccines for youth. I think one of the basic ones is just spreading the word about these state laws. If you're in one of these 34 states or DC, please let everyone know. Put it on your Facebook page. If you work in a school district, put it on your school district's Facebook, put it on your website. Share the information with school-based health providers, with community-based health providers, with liaisons, social workers, people who work in programs that are serving unaccompanied youth, and try to share the word, you know, directly with youth as well. Help them to know what their rights are. It might help to provide them with just sometimes even just the link to the law. I know youth who have gone into offices of medical professionals, and the professionals have said, no, sorry, you know, we can't take care of you without your parent. And they've actually just pulled out their cell phone, pulled up the law on their cell phone. And that healthcare provider just didn't know, you know, and once they see the law and they say, oh, wait, wow, I actually didn't know about that. Sure, come on in. You know, we are here to help you. That's what we want to do. And we're very happy to be able to do it. So I think it's important to help youth know just where to find the laws, help them to understand what it says. And then, of course, to make sure that all of our healthcare providers really understand what these laws say, and that for unaccompanied youth experiencing homelessness, they actually can access this care. On the next slide, we wanted to talk a little bit also about some of the interactions between unaccompanied youth and other programs. So it's not appropriate to automatically call sort of Child Protective Services or CPS anytime that you're working with an unaccompanied homeless youth. We do hear some people who think, wow, you know, if there's a 16-year-old and they're not with their parent, maybe they should be in foster care. And maybe, you know, for some youth that might be an appropriate placement. But what we know from research is that for the vast majorities of these youth, if they are afraid that they are going to be referred to child welfare, referred to law enforcement or some other system, they are much less likely to come forward and ask for help. because they don't want to be involved in those systems. They're trying to protect their parents. Oftentimes they're trying to protect siblings. And for the most part, especially when we're looking at older teens, unless they're in some immediate danger, the child welfare system is unlikely to intervene anyway. So, it's really important to help youth understand that, this is a healthcare facility, or you're here at school, we're here to help you, we're on your side. We just want to help you access some basic healthcare. And, we can figure out later if there's something going on in your life that requires us to call CPS. But, for the most part, that actually does not come into play. It might sound surprising, but it does not come into play for most of our youth. We also wanted to just encourage you, if you are able, we understand that not all schools and districts are able to do this, but if you're able to offer vaccines on site, a lot of our unaccompanied youth really struggle with transportation. They struggle with the ability to get to places that might be offering vaccines. So you might say, well, we've got 20 vaccine clinics in our city. They don't need to come to school to get their vaccine. But for a lot of our unaccompanied youth, it's hard for them to get to those sites. It's hard for them to get there when those sites are working, because the youth are in school and they often have part-time jobs. So they might, all of a sudden at 11:30, it's the first time that day that they have free time. And they're not obviously going to be able to go to a vaccine clinic at 11:30 at night. So if you're able to do that at school and prioritize your unaccompanied youth for access at school, that eliminates a lot of barriers for them. And also it's a site where people know about these state laws. So they don't have to worry about going somewhere else where someone's going to say, no, you're 17, we can't give you a vaccine. And then they're going to have to go through the whole process of educating a provider. For those of you that are not able to offer vaccines at school, if you can help youth with transportation, you might be able to provide them with some gas voucher or gas reimbursement. You can use some of these ARP-HCY funds, for example, to provide gas vouchers for students. You might be able to help them if you are providing them with a public transportation card to get them to and from school. They can use that same public transportation to get to a vaccine clinic. So just help them understand where they're located. We know all this is on the internet. We know you can find it, but it really helps to sit down with unaccompanied youth and kind of walk through it with them. Here's where the clinics are. Here's what the hours are. Here's how you can get there. Here's the bus you can take. And again, to provide them with that self-advocacy documentation. So if they are turned away at that clinic, that they have the document, whether it's in paper or on their phone, where they can say, oh no, wait, at my school, they told me there's a law and you can give me the vaccine. And then they can share that with that healthcare provider. So those are some suggestions in terms of helping your unaccompanied youth access vaccines. On the next slide, we want to talk a little bit about testing. So we can move forward to the next slide. Testing is a big issue, particularly when there might be issues of quarantine involved. So again, in these 34 states and DC, youth can go ahead and consent for a PCR or whatever the testing is that's being done in your school or in your area. So again, helping to spread the word about those laws. But also helping to be flexible a little bit as well. We understand, at least I'm not a medical professional, but my understanding is PCR is sort of the gold standard of the best test that you can get. But, if youth are not able to access that, let them get some over-the-counter tests, let them get those rapid results tests. Maybe you do it 2 or 3 times or whatever you need to do to feel like there's some confidence there in that result. But we really want to keep youth in school. We don't want to just sort of fall back on, well, we'll just send them home for a few days and see how they do. And we're going to talk in a couple of minutes about why that can be so devastating for unaccompanied youth. But so the ability to get an over-the-counter test, rapid test, get testing at school, again, so they don't have to go somewhere else and try to deal with transportation and all that, but go ahead and provide them with a test right there at school, so that they can avoid that potential quarantine if there might be an issue of having close contact with someone who might have COVID. So those are some of our tips there to try to keep our students in school and get them access to testing as well. On the next slide, I think where you wanted to go into quarantines. Yeah, this has been on my mind. I actually just found out today that my little nephew has COVID and is quarantined with most of his kindergarten class and with my niece and nephew. And they're lucky, right? Because they just called their jobs and say, oh, we're all quarantined. We've got to stay home with our little kid, and they're staying home and they're doing their thing, and they're fully vaccinated, and I believe that they will be fine. But our youth experiencing homelessness don't have that kind of situation. First of all, they're very likely to be staying with someone who is going to say to them, you have COVID, you can't stay here anymore. You've got to go somewhere else. They might be trying to stay in an overcrowded motel room. They may be in a shelter, although that's unlikely, but they're very likely to be in a place where, they're not just going to have someone stay home with them and make them juice and fish sticks like my niece and nephew are doing for my little nephew. But they're basically going to say, you have to get out, you have to go somewhere else. And so where do they go? They don't have anywhere to go. So now we have an unaccompanied youth who has COVID or may have COVID, and they're literally just out on the street hanging around, where we don't want them to be for their health, and we don't want them to be for the public health either. So that's why we really want to try to avoid quarantines and sending unaccompanied youth and any of our children and youth experiencing homelessness, quote unquote, home. They don't have that same kind of home to go to that some of the other students have. So to the extent that we can get them tested and keep them in school, get them vaccinated, and try to provide them with whatever stability we can and avoid that quarantine, that of course is really ideal. If they do have to go into virtual learning, even if it's just for a day, that really does set them back. Like I said, they often have nowhere to be. So they're not just going to sit, in the living room doing their Zoom meetings or whatever's going on. They're not even necessarily going to have a place to pull out a pen and paper and do something on paper. So we're really focusing on trying to keep them in school. We know from our experience with distance learning last year that almost 500,000 children and youth experiencing homeless just disappeared. They left school, we don't know where they went, and we're trying to find them now that we're back into in-person learning, make sure they're back enrolled, make sure they're in school again where they can get the support that they need. So those are a few issues that we wanted to share with you there around quarantining.
Thank you. I think Levi, you are up next.
Yes, I am. If I can find my unmute button. Thank you so much. So you'll see on the next slide some of the stories that we have been hearing around promoting access to education, health, and safety during school quarantines. Of course, expanding and promoting access to educational services is a critical part of supporting students experiencing homelessness. And we've already heard some promising stories around from schools and districts around making sure that students experiencing homelessness who already have been so impacted by the COVID-19 pandemic can continue to access education and educational services. That can include providing access to needed testing at schools at no additional cost to children and youth experiencing homelessness. It includes assisting families and youth with any need to transportation to testing sites, if those testing sites are not already located in schools, and working with McKinney-Vento liaisons to establish district-wide plans for communicating with and supporting students experiencing homelessness during any necessary quarantines. On the next slide, you'll see that there are a couple of additional bullets that we've been hearing, including checking in on identified students and children and youth experiencing homelessness daily throughout the quarantine period, making sure that they can access testing, finding safe or stable places to stay, food, and that they have everything that they need to participate in virtual learning, which of course includes technology and access to Wi-Fi. Publicizing information about the definition of homelessness and making sure that youth and parent-facing information around McKinney-Vento rights and services is accessible. I know, again, whenever I was a student who experienced homelessness, I did not know that I fell into the definition of McKinney-Vento, the McKinney-Vento definition of homelessness, and there's a lack of understanding, particularly on behalf of students themselves, around whether or not they may be accessible for some of these resources. So it will be critical and to make sure that those rights are shared and articulated to students broadly. And then, of course, working with community-based youth homelessness and housing partners to ensure that students experiencing homelessness are able to continue accessing classes virtually or otherwise.
Oh, you all went through your content efficiently. Thank you all so much. So now we're going to open up for questions. I've seen a couple come in that I'll read aloud, but this is a great time to put anything that you have as burning questions in the chat box or in the Q&A. And we will open up to the presenters to go ahead and answer those. So the first question I have here for the panelists are, the first one says, in Oregon, a minor 15 years or older can give consent to medical services. How do we go about getting those services to an unaccompanied youth under the age of 15? Who wants to take that one?
So I can start on that one and see if anyone wants to jump in. So, and I should have mentioned this earlier. Some of the state laws, many of them, not all of them, do have minimum ages. So you do have to check your state law. 15 is common, 14 is common. Some of them don't have any age at all. So you just have to check your state law. But that is a limitation. So in Oregon, if the student is under 15, you really don't have a way to access medical care without a parent or guardian. So in that case, and in those other states that don't have laws at all, really what you're kind of stuck doing is trying to see if you can locate a parent at all, and see if that parent might be willing to sign a healthcare power of attorney. It's important to note that those do not affect parental rights. They don't intervene in the sort of dynamic of the family or the legal relationships within the family at all. What it does is it just gives an additional person the right to make those medical decisions. So, you know, when my niece travels with me, her mom signs a medical power of attorney for me. So if something happens to her, I can go ahead and get her help. So I know that sometimes liaisons and social workers are successful in finding a parent and just saying, hey, can you just sign this document because your child's sick, they need some help. We're not going to get involved in your family dynamics, but just to help them access healthcare.
Sorry, now I couldn't find my unmute button, Levi. And I would just share to the audience too, for those of you who are not in the school-based healthcare field, I think a lot of you are, but sounds like some are joining who are not necessarily familiar with school-based health centers or school-based healthcare happening on site at schools. So Oregon is a state that has a lot of school-based health centers or partnerships with local health care entities that bring care to schools. So I would encourage you to take, you can do through our website, School-Based Health Alliance, or reach out to us, but also we have state affiliates. We do have one in Oregon to help you identify where there are school-based health centers or school-based healthcare happening in your state. And sometimes those schools where that's happening, they allow students in other surrounding schools to come to that school for care. So there might be a school-based health center delivering, providing primary and physical health care, including vaccines, and then other students in the nearby areas, that center may be open to them as well. So we certainly can help link you to any of those if you are looking for those in your state. Okay, the second question in the Q&A is the McKinney-Vento liaison is not included with a student if the administration is considering ISS, so in-school suspension, or OSS, out-of-school suspension, for an identified homeless student. Is there ideas on how to work through this kind of need? So if the McKinney-Vento student is not is not included with the student if the administration considered ISS or OSS. So how do we work through that?
I guess I can jump in to start too, and then see if anybody wants to chime in. So there are a couple of states that do create a role for the McKinney-Vento liaison in discipline matters, but that's very, very unusual. So in the case of North Dakota, that's common that there's not a role for the McKinney-Vento liaison. So this would really just be about relationships then. It would be about the liaison building relationships with the team at the district and the school buildings that is involved in disciplinary matters. And saying, you know, whenever you have an identified student, a McKinney-Vento student, we want to know, we want you to inform us, we want to be able to chime in because we know what's going on in the child's life outside of school that might be impacting their behavior in school, and how important it is to keep them in school. So again, kind of like with quarantining, when a McKinney-Vento student gets sent home on out of school suspension, where are they going? You know, they're not sitting at home playing video games all day. We have no idea where they are. So, you know, those out of school suspensions are a real problem for McKinney-Vento students. So I guess I would just encourage that relationship building with your disciplinary team at the school building and school district level. You can provide them with some education around what your students experiencing homelessness are going through, and how that impacts what the way they're kind of exhibiting that at school. And ask for some input into those kind of decisions.
The only thing I would have to add to that is just that there's a broad mandate with the McKinney-Vento Act to review and revise policies that act as barriers to identification, enrollment, participation. So if a student should not be disciplined for a behavior that was directly related to their homelessness. So for example, absence for 7 days, they didn't have a way to get to school, the homelessness was why they were absent, that student should not be penalized. So there is a broad McKinney-Vento mandate related to disciplinary action that is caused directly related to homelessness.
Thank you both. We have a few more coming in. The next question is, in California, the age is 15, but can be 12 if the student has come into contact with an infectious disease and then may consent to care related to the treatment of the disease. Would that include a vaccination?
Leave it to Susie to ask a question like that. That's a really hard one. I've been considering that myself, and I don't know, Andrea, if you have a thought about it. Is a vaccine treatment of a disease? I don't know the answer to that. I definitely think testing, because most of these laws around treatment to disease also include diagnosis. So testing, I think for sure. The vaccination, I think, is an open question. I mean, obviously I want to advocate for the student. So I'm going to try to argue that yes, I mean, part of treatment of a disease is prevention. Prevention is part of healthcare. It is part of healthcare treatment. So I'm going to try to argue yes, but I'm not 100% sure. Andrew, you're nodding. I like that.
Yeah, I don't know legally, but I completely agree with you, Patricia. We would consider that prevention, not treatment. So it would depend on what that healthcare entity and the schools laws are defining as what they're allowed to consent to for care. Yeah, that's a hard one. But thank you for asking, Susie. It sounds like she asked the hard one. Okay, next we have, who is responsible for the healthcare bills?
So most of the state laws are silent on that question. There are a few laws that actually specifically state that the parent is not financially responsible if the parent did not consent. So most of the state laws are silent. I would say, though, that for your McKinney-Vento students, most of them are going to be eligible for your child healthcare insurance program in your state. So I know it's called different things in different states, but your CalMed or your Husky Care or whatever it's called in your state. So there should be public health insurance that'll be able to cover that regardless of who consented for the care.
Yes, and I would just add to that, if it is a student seeking care at a school-based health center and they are consented to that health center, there's no cost, and there's either insurance or Medicaid or something on file for the student, and if not, the student still receives care. So regardless, there's no payment to the student at a school-based health center. Next, okay, does the 10-day drop rule apply to an identified McKinney-Vento student due to funding? They are automatically dropped. Is that correct, or is this waived due to McKinney-Vento?
So I'd refer back to what Barbara said earlier about the requirement to revise policies and practices to remove barriers to enrollment and retention in school. So I think the first thing that you want to do is find out why the student missed school. We know that students experiencing homelessness have very high rates of chronic absenteeism. They're often missing school because of transportation problems. It might be because of hygiene issues. They don't want to come to school because they don't have a place maybe to take care of their hygiene needs. They don't have shampoo or soap. They don't have the right clothes. They may be ill. They may have an illness that may be related to their homelessness. So there's so many reasons why they may have missed school. I think the first thing is to find out why they're missing. It would not be appropriate to just say, oops, missed 10 days, withdraw them, and never follow up and never find out what happened with that student and what was going on. The school absolutely would have to find out, intervene, provide supports. And if that absenteeism persists over time, then you sort of sit down and try to make some decisions about what's going to be the proper course for that student, but certainly not an automatic 10-day drop.
Thank you, Patricia. Another one that looks a great question, looks like a good a challenge that is probably very real. It says, what is your advice for students who have a signed form from a McKinney-Vento liaison saying they are legally allowed to consent for the young person, but the medical provider still refuses to provide care because it's against their policy not to have a parent or guardian to consent?
Thought I'd wait to see if anybody else wanted to go first that time, but I will give it a try. I think this just requires education with the medical provider. So there's no state law that I'm aware of that actually requires a medical professional to provide care without parent consent. The youth can consent for themselves, but there's not a requirement that the medical professional accept that. So I think, I have run into that problem myself also. And some of what we have tried to do is to sort of work through the healthcare community. It's one thing for me to say something to a medical professional. I'm not one, but if it comes from a peer, oftentimes that's a more persuasive argument. So maybe work through your state pediatric association, your state nursing association, other healthcare professionals within your state or your community who are providing care to these youth, and ask them if they could reach out and say, look, we've been doing it. Nothing bad has happened. We haven't gone to jail. We haven't been sued. It's okay. You can do it. And particularly, considering the vocation of healthcare providers, this is something you really should be doing. We want to keep our children healthy. And so by helping to eliminate this barrier, you're doing that. You're helping to live out this goal that we all have as healthcare providers. So I think, we can try to persuade, but I would suggest trying to get other healthcare providers to help you with that persuasion.
Yeah, I didn't have anything to add to that. It's not, because the first thing that came to mind was not helpful, which is find another provider who will, but that's not helpful if you only have one provider. There's only one there. So I think, that persuasion piece is the best we can offer right now. I'm going to put in the chat box too. This is to go back to the issue of discipline and how that's interacting with homelessness. Research from the University of Michigan that I think is really important that looks specifically at the disproportionate rate of discipline for students experiencing homelessness, particularly students who are experiencing homelessness who are also of color. So I'll put that in the chat box.
Oh, that'd be great. I see a few comments, not necessarily questions, but continuing around that conversation. So thank you, Barbara. Another question that came in the chat box: some of our districts are requiring COVID vaccinations and some students do not want the vaccine, their choice. And health services staff states they have to have the vaccination. Suggestions what to say to the health services staff?
I'm wondering if there are any exemptions in the district for other students. Are there religious exemptions or other things, or is this just 100% everyone's being required to be vaccinated in order to come to school? I guess that's just sort of a pre-question that I have.
The only thing that I would add to that is a part of ARP funding. ESSER is the Elementary and Secondary School Emergency Relief Fund, and there is a portion of that funding that states and districts can use not only to implement vaccine policies and plans for themselves, but also to increase awareness and comfort with the COVID-19 vaccine. Some schools are partnering with community partners and hospital partners. Some are having in-site vaccination clinics, and there is a portion of that funding from ARP that can be used for those purposes. And so I think that part of the work is making sure that communities, particularly communities that would be most impacted by COVID, are aware and are comfortable knowing about the COVID-19 vaccine. And I think that the schools can play a critical role in making sure that students know that it exists and know that it's safe.
Great, thank you. I don't see any more questions coming in yet. We'll give it one more minute and see if anything else comes in. And I did just want to let everyone know we did see a couple questions coming in and tried to answer in the chat, but all participants will receive a follow-up email after today's webinar, which will include the resources that are shared by Schoolhouse Connection. And we will also be posting this recording and the accompanying slides to the School-Based Health Alliance's website by the end of this week.
Andrea, I actually have a question for you. I'm going off script a little bit here, but something that somebody wrote in the chat raised a question for me about undocumented students. I'm assuming that school-based health clinics will serve undocumented students and won't even ask the question about their status. Is that right?
Absolutely. Absolutely. So School-Based Health Center will have the same traditional enrollment and consent that any healthcare entity would. So there would be a parent or guardian who would enroll the student via a consent form, or with homeless youth, whoever would be the designated adult, unless it is the minor protected healthcare that you discussed earlier. And absolutely no status is asked, just the same as with traditional healthcare. And a school-based health center will be operated typically by an external healthcare entity. So they follow all of those traditional practices.
Okay. And I know healthcare for the homeless clinics also would take care of someone, because I know the issue usually is who's going to pay, right? The access to insurance. So finding those free providers is really the key.
Yes, and actually one of the partners who linked us all up that we can share as part of the resources is the national, oh my goodness, I'm going to mess up their names, but Barbara, you might have it right on hand, but thank you. If you could share it in their website, that'd be great. Our I'm so sorry, I'm going to mess up their name, but the organization that represents health centers across the country who serve people experiencing homelessness, and they have some additional homeless grant dollars to particularly serve those students and families and individuals. Thank you, Barbara. I see you putting it in the link. National Healthcare for the Homeless Council. I always get the acronym wrong. Thank you. And so we work with them and other national partners that represent community health centers, which is, I think, what you're referring to in general, Patricia, offer free or low cost care. Some people know them as federally qualified health centers, but they're community health centers vastly across the country, and they that is the mission, to support those people who are vulnerable or lower income areas, and so that is absolutely a place for where students experiencing homelessness can get care if there's not care happening directly on site at school. And there are other health entities in the community as well, but community health centers are given grant dollars from the federal government to serve individuals that fit into those categories. So it's a mandate. Yes. Let's see, I have one more question that just came in. Okay, great. I'm a social worker for a basic center program, and I'm having trouble getting MV liaisons to connect with the program and spread the word about it and offer referrals. We are mandated to work with them, so this is frustrating. Any advice on engaging with them?
I'll start this time. Nope. Well, Patricia just came off mute. Shoot. I think, well, first of all, they're also mandated to work with you. So there are reciprocal mandates. For the Basic Center program, which is under the Runaway and Homeless Youth Act, and McKinney-Vento liaisons are required to work with all providers of services to homeless youth. So that is an important piece there. One approach is to, first of all, you could email us and we can try to do some McKinney-Vento matchmaking. You might also reach out to the state coordinator in your state and see if there are trainings that are happening. For example, we like to do what we call, again, different kinds of McKinney-Vento matchmaking, but is the state coordinator doing a training specifically on the Runaway and Homeless Youth program? Can that person help be a convener? Can that person help make the connection there? Would be probably my strongest recommendation, and see if Patricia or Levi has others as well.
I will jump in to say that the resources that Schoolhouse Connection has to do, as Barbara said, matchmaking is incredibly useful, and so I would certainly encourage encourage the asker to take her up on that offer. I know that the liaisons have a ton on their plate, just like everybody else does every day of the year. And I'm certain that they would want to continue to work to make sure that the students that they work with and serve have access to the educational services that they need. I'm gonna have to run a little bit early, but thank you so much.
Thank you, Levi. We have one last question that came in, and then we'll wrap up and launch our evaluation poll. These are fantastic questions. So the last question is, the internal message system is used to contact staff during the school day. What information can or needs to be shared if there is an identified LGBTQ enrolled student?
I think my first answer there would be none. I mean, there may be something going on with a particular student that you're concerned about. There might be, academic needs, mental health needs, other things. And so you might want to communicate about those particular needs. But I certainly would never just sort of use the internal message system to out an LGBTQ student at all. I mean, you might want to have a private conversation with them and ask them, maybe they want to talk about it, but they don't know how, and you could support them with that. But that definitely has to be their information, their decision at their pace. And so I would say, just basically nothing would be my answer to that, generally speaking.
Wonderful. Thank you so much, Barbara and Patricia and Levi, even though we hopped off. This is fantastic dialogue. And we promise we will share all of these resources and slides. It's really great dialogue today. You'll see the poll launched on your screen. If you could take a moment to fill it out. And Harper, if you don't mind just putting up our information slide, that would be great, just as people are wrapping up, in case you want to reach out to the School-Based Health Alliance for any further information.